Labral tears of the shoulder joint. The glenoid labrum is a rim of fibrocartilaginous tissue that deepens the socket of the shoulder. The socket is quite shallow in relation to the ball, so the presence of the labrum helps to provide static stability. Trauma to the shoulder, especially dislocation, can damage the labrum. Different parts of the labral ring can be damaged depending on the mechanism of injury. A Bankart lesion is damage to the labrum at the front of the shoulder. This can be due to an anterior dislocation of the shoulder. When the shoulder is forced forwards out of the socket, it can disrupt this front part of the labrum. A slap lesion is where the long head of biceps, which attaches into the top of the labrum, can forcefully pull the labrum away from its topmost attachment. A reverse Bankart lesion affects the back of the labrum. These labral deficiencies decrease the stability of the shoulder due to a decrease in the restraining effect of the labrum. As such, they can lead to other shoulder pathologies such as subacromial bursitis. The subjective assessment of a physiotherapy assessment needs to determine any relevant previous trauma to the shoulder if a patient presents with shoulder pain. MRI or MR Arthrogram, where a dye is injected into the shoulder, can be used to assist in diagnosis, although these investigations are not 100% reliable and can miss labral pathology. A shoulder arthroscopy, a camera inside the joint, is more reliable. If necessary, a labral repair can be carried out. This uses bone plugs to anchor the labrum back onto the glenoid rim. Physiotherapy to try to increase the dynamic stability of the shoulder via muscle retraining can help, although it cannot improve the static stability of the shoulder joint as there is structural change. Recurrent problems benefit from surgical intervention to repair the labrum, and here physiotherapy can have its greatest impact in the rehabilitation phase following this intervention.